Here are ways to help ensure quality of life and ways to prolong life when you have type 2 diabetes that you can refer to. 1. How to prolong life when you have diabetes. Change your diet. Fruits and vegetables. A healthy diet is the first step you need to take to reduce cardiovascular risk factors such as high blood pressure, hyperlipidemia, and hyperglycemia. You should try to plan an active meal plan. Ensure balanced meals between carbohydrate, protein, fat, vitamin, mineral and fiber food groups under the advice of a dietitian or nutritionist. Your treating doctor. You should limit your intake of salt, fat, sweets, etc. You should choose foods with a low glycemic index, rich in fiber and vitamins such as brown rice, whole grains, legumes, green vegetables, etc. Fresh fruit less sweet. 2. Exercise more. Exercise lowers cholesterol. Daily exercise not only helps you control your weight, control blood sugar, but also helps you have a healthy, supple, and balanced body. Regular exercise is good for your cardiovascular system. The recommendations recommend that people with type 2 diabetes should do at least 30 minutes of moderate intensity exercise per day. These exercises can be jogging, swimming, or aerobics, so that they affect all muscle groups in the body. Also, don't forget that if you want to build strength and lose more weight, you should do resistance exercises that require strength like running, climbing, weight training or playing a sport like soccer or tennis. However, you should note that you should warm up before practicing resistance sports and should choose the subjects and postures that are suitable for your health. 3. Track treatment goals. Eat while using a blood glucose meter. The goal of treatment for patients with type 2 diabetes is not only blood sugar control, but also control of weight, blood pressure, and lipids. These are also high risk factors for cardiovascular disease. At each follow-up visit, the doctor will examine and order tests to check for the above factors. However, you can also monitor your own blood pressure and glucose readings at home with compact and easy-to-use handheld meters. You can talk more with your doctor or counselor about how to use these devices and when to measure your blood pressure, blood sugar, and treatment goals. 4. How to prolong life with diabetes. Manage stress. How to prolong life when you have type 2 diabetes. Anxiety and stress can disrupt blood sugar, increase blood pressure, and adversely affect cardiovascular diseases. If the anxiety is not too severe, you can travel, play sports, meditate, etc. to relieve stress. When the condition worsens, making you lose sleep, loss of appetite, confusion, fear, even depression, you need to consult a psychologist, neuropsychologist in order to timely interventions. 5. How to prolong life with diabetes. Quit smoking. Quiz: have you quit smoking properly? Smoking is a high risk factor for respiratory and cardiovascular diseases. Second-hand smoke increases the risk of lung cancer, chronic obstructive pulmonary disease, and atherosclerosis. People with diabetes who smoke have a higher risk of stroke, heart attack, and amputation than non-smokers. For a healthy heart, you should quit smoking as soon as possible. 6. Adhere to the treatment regimen and follow up regularly as scheduled. How to prolong life with diabetes. One of the important issues is the patient's adherence to treatment and scheduled follow-up visits. You should not arbitrarily change the treatment indications of your doctor without consulting and obtaining the consent of the treating doctor. Arbitrarily changing the treatment regimen can not only make you lose control of your health condition but can even endanger your life. You should have regular check-ups with your doctor, even if you feel well and your blood pressure and blood sugar are within normal limits. During each medical visit, the doctor not only checks your blood pressure, blood fat, and blood sugar, but they also adjust your nutrition and treatment regimen accordingly, as well as screen you for complications of diabetes. Diabetes. If these complications are detected early, treatment or prevention is more effective. Doctors are not the ones to judge your treatment or activities, they are the ones who support you to control your disease and improve your quality of life. Therefore, Do not hesitate to share your worries and questions about the disease. Understanding between the two sides will help the treatment results better. Hope the above information will be useful to you.